Here we go. So thank you again, everyone, for joining us today. Happy New Year. We are back with our Q&A sessions that we've been doing pretty regularly, about every other month or so, something like that. So we will be continuing to do that. My name is Laura Santner, and I'm a therapist here at skinpick.com. I've been working with BFRBs a really long time, so I'm here to answer any of your questions. It's going to be a pretty casual Q&A session. Get some water or some hot chocolate. Make sure you have a fidget. Here is my fidget for today. We all have fidgets. This is actually like a slap bracelet. Oops. It's like ugh. There we go. See, a silicone slap bracelet with little spikes. So this is my fidget for today. I also have a little sticker for the new year that I wanted to share. If you can see it, I don't know if it's backwards for you or not, but it says everything will be okay. Hopefully it's not backwards for you. Okay, so everything will be okay. We will be going for about an hour. And I'm going to go over the most commonly asked questions first and the pre-submitted questions, and then I'll get to your live questions. Okay. So let me get to okay. So our commonly asked questions is what causes skin picking? Right, it's probably one of the most commonly asked questions. We all want to know, why is this happening to me? So it's pretty complex, and there are no real answers, unfortunately. But right now, research is showing that there's a strong inherited predisposition. So what that means is there is a strong genetic component if someone in your family, anywhere within the family, has it. Whether it's active or not, um, makes it more likely that you will develop it. But even if someone in your family has it, it does not mean that you are going to get a skin picking disorder. It's a combination of factors. So, yes, there's an inherited predisposition, but other factors that could trigger it also include like age of onset, your hormones, the temperament, any other co-occurring disorders, environmental stress factors. So it's not just one factor that's going to cause skin picking. It's a combination. It's a variety. But one thing is for sure, it is not your fault, and it is no one's fault. Okay, it happens, unfortunately. Let's see. What kind of therapist do I look for? Okay, so the number one thing is you want a therapist who you're comfortable with, right? Someone who you like and who you're comfortable with. But it is also quite helpful to have a therapist who is trained, who is specifically trained in working with BFRBs. So, what that looks like is you want to look for someone that uses certain modalities, right? So, um, the different modalities that you want your therapist to be familiar with would be the comprehensive behavioral model, or COMB, acceptance and commitment therapy, ACT, uh, habit reversal training, HRT, cognitive behavioral therapy, CBT, dialectical behavioral therapy, which is DBT. So it's kind of the combination of all of those things. And of course, just regular, psychotherapy, talk therapy as well. So, but you want to make sure your therapist is trained and knowledgeable about those specific areas. Okay, so you can find knowledgeable therapists, of course, on skinpick.com. All of our therapists are knowledgeable and trained. There is also a list on skinpick.com. There is a list of providers on bfrb.org as well. However, just an FYI, bfrb.org is their website is not going to be active for too much longer, maybe I think the end of the summer. So their provider list is going to be moved over to the International OCD Foundation. So that would be the next place to be looking for providers, even though BFRBs are not OCD. Just want to clarify that. They're kind of like cousins. but there will be a provider list under the International OCD Foundation if you want to look over there as well. And again, you're looking specifically for someone who is trained in skin picking disorders. Okay. Let's see. How common is skin picking? So the DSM fifth edition says that about 1.4% of the population has skin picking or dermatillomania, or excoriation disorder, right? It has a couple of different names. However, more recent findings is it's actually more like 2 to 3%. Um, Hold on, I see something just popped up on the screen. Oh, some meeting can't hear me. Okay, they must update to the latest client version to hear live performance audio. Okay, I hope most can hear me. If you can't, definitely, yeah, let me know. Okay, thumbs up, you can hear me. Okay, good. Okay, so, okay, good. Lots of thumbs up. Excellent. Okay, so right now, basically, research is showing that about 2 to 3% of the population have skin picking. So that is translates to about 1 in 20 people. And the reality is it's even more because people don't realize that they have a skin picking disorder. People don't report it, or it doesn't impact their lives and they don't feel like it's a big deal, or they're embarrassed by it. So the reality is, I believe it's way more than 2 to 3%, even though that's actually quite a bit of the population. But the reality is it's probably even more. Okay. Um, just want to quickly check. Oh, so someone is asking, can you see us? No, I cannot. I cannot see anyone. Okay. Um, Good question. That's a good one just to clarify. So this is anonymous. When you ask questions, I'm just reading your question. Even if your name pops up for me, no names will be mentioned. Okay, everything is anonymous. Okay. Um, so is dermatillomania, or skin picking disorder, a lifelong struggle? Is it possible to stop? So Un unfortunately, this is a chronic disorder. So what that means is that there is no cure. And yes, a part of it will always be with you, will be lifelong. That does not mean that it is always going to be active. And it does not mean it's always going to interfere and bother you, and impact your life. So it could reach a point where those urges kind of become dormant. And that's where what we want, right? We want to practice different skills so that they become dormant, and not as strong and not bother you as much, right? So I think that the more you educate yourself, the more you practice, the more mindful you are, that will help for it to kind of decrease in intensity and in frequency, and that's what you want, right? So the goal is for it to not interfere and not upset you, okay? And hopefully, again, become kind of dormant. It does kind of come and go, unfortunately, but if it comes, hopefully it will be like less intense than it over time. Okay. But unfortunately, it is chronic. Are there any skin treatments available to remove evidence of picking? So scarring can vary, right? It just kind of depends. So some scars can, go away in a couple of days. Some take more like a couple of weeks. And some may even take like 6 to 18 months, again, depending on the severity of the picking. And if, other factors include if there was any kind of infection, or any kind of tissue damage. So that's going to affect the healing process as well. If you're not actively picking, it's going to heal a little bit faster. So have patience, and be gentle with yourself. If you are not actively picking and it's really taking a long time to heal and you're really upset by it and it bothers you, consult with the dermatologist. I mean, there are options. Um, and they again they vary in intensity. So there could be different kinds of creams and ointments to help with scars, different silicone pads, and then more extreme treatments such as laser and even skin grafting. But start with the like with waiting and patience and being gentle, and start with things like creams and ointments, and silicone pads. I would say that would be like the beginning stages. Okay. Okay. I'm seeing some live questions popping in, so good. I will address those in a little bit. Okay. Another commonly asked question: are there medication options to help manage urges? So, unfortunately, there is no FDA approved medication. Um, However, right now, the most researched and the most promising medication is an amino acid supplement, and it's called NAC, or N-acetylcysteine. So right now, that's the one that's again most researched and most promising. Um, and the brand, I get asked a lot about brand recommendations. So the one that that cooperated with research was called Swanson, with the original research at least. So Swanson is a good brand. I also like the brand Now. It doesn't really matter. If you try one brand and you don't like it, try another and just see what works for you. The I get asked a lot about dosaging as well. So the typical for NAC and acetylcysteine, the recommended dose is 1,200 milligrams. So and broken up. So usually it's like a 600 milligram tablet, like in the morning, and a 600 milligram tablet in the evening. What was studied, it went up to 2,400 milligrams. So two tablets in the morning and like two tablets in the evening. Or take it when, right before a period of time when you typically have higher urges, because it is short lasting. So generally short lasting. So you want to kind of take it preemptively if possible. Okay. Um, Another medication that's up and coming and exciting is called memantine. Memantine is actually an Alzheimer's medication, but it targets the glutamate receptors just like NAC does. So research is showing that BFRBs, skin picking, is related to basically like glutamate imbalances. So there's some interesting stuff going on. So the newer one that's looking also promising is called memantine. And right now, what I found was that the dose that was studied was 10 milligrams a day and increased to 20 milligrams. So far, that's the information that I have on that. Um, Let me see. I'm gonna jump to this question. So, um, besides I know we talked about the potential causes of skin picking, but another commonly asked question is like why, right? What are common triggers? Why am I picking? So in order to answer that question, I typically recommend doing some self-monitoring so you can learn about your patterns and figure out what your triggers are. What are the situations? Common triggers, for example, are when you're overstimulated or understimulated. So skin picking acts as a way to regain balance and regulate your body. So overstimulated when you're like feeling anxious and overwhelmed, for example, or understimulated when you're bored. Also being tired is a really big trigger. So those are kind of like the main umbrella triggers. Right. If you want to look a little bit more specifically, I think of the model, it's called SCAMP, sensory, cognitive, affect, motor, and place. So what that means is that you can have sensory triggers, um, right? How it looks, how it feels, right? You have cognitive triggers, your thoughts can trigger urges. Affective triggers, meaning your feelings, can trigger urges. Motor triggers are like your movements, your body position, right? If you're like here, you might just automatically start picking. So barriers are really good in that situation. And place. So like bathroom mirror, in front of the TV, couch, if you're sitting in this same spot on the couch every single time. Um, right. So it's environmental as well. So those are some common triggers just to be extra mindful about and things to think about. And we can, again, if you have more questions about it, we can get into more detail. Just write in the Q&A box. I do see questions coming in. Um, what are some goals I can work on in 2026? I love this question because I feel like when it's a new year, it feels like a new beginning and people get like extra motivated. So, what are some goals I can work on in 2026? One thing to be mindful of is do not have a goal of stopping to pick. I know that sounds weird, but if your goal is I'm going to stop picking, um, that tends to kind of be like black and white thinking or all or nothing thinking. And it typically leads to disappointment and frustration. And you ultimately wind up picking more. Um, so instead, I encourage you to focus on management and being kind to yourself. So a goal to consider would be to focus on strategies. In 2026, I'm going to focus on my strategies. Um, and select some strategies. I usually encourage people to think about like 1 to 3 at a time to start. And then as you feel more comfortable, build on that. So you really want to focus on strategies. And as you wind up working on your strategies, then you wind up naturally decreasing the picking, hopefully stopping the picking. But the goal is not to stop. But you wind up getting there. Or again, managing it until you feel like you're in a place where it no longer interferes, where you feel comfortable, where you feel more confident in your skin. So goals about being confident, being comfortable with yourself, and enjoying and engaging in the activities that you love again. Okay, and being gentle. Be gentle with yourself. Okay, so think about goals like that. How can I hold myself accountable for working on my goals and staying motivated? Yeah, so as I mentioned before, doing self-monitoring is a really helpful way to keep track of what you're doing, what's going on, learning about your patterns, learning what your body needs, so that you can best help yourself and fulfill those needs. What I like about self-monitoring is it helps you to kind of stay on track and helps you to be accountable for yourself. And it's a really nice reminder, whether or not you're doing it multiple times a day or once a day or even just once a week, it's a space for you to pause and to reflect. So I think that that's a really nice strategy and opportunity. There are also different apps that kind of turn tracking into like games. Um, don't ask me what the specific apps are because I don't know off the top of my head. I keep forgetting the names of them, but search for them. But they have different kinds of tracking apps where you can get like rewards for, completing tasks for the day and the tasks that you set for the day. So that can be kind of exciting and a little bit more motivating. Um, I used to always recommend like charting your strategies. So like a star chart or a check mark and like checking off every time you do a strategy. And it's really nice to see those stars and to see those checks. And again, when you have it written down, it's more motivating and it's a really helpful reminder. Oh, I didn't do a strategy today. Let me do one right now. Right. Um, the new trend, which is kind of a great idea, is to make yourself punch cards. So pick a strategy, choose a strategy and put it on a card. And every time you engage in that strategy, you punch it, um, which is also a nice sensory um, and motor movement, right? Punching, it feels really good to punch the card. And then when you fill up the card, you give yourself a reward. Having a reward system can be really helpful at all ages for managing urges and picking. And it could be, little rewards and building up to bigger rewards. So I definitely recommend reward system. Um, and the reward would be whatever makes sense for you, whatever is like exciting and motivating. You can also have a buddy to check in with. So if you have, whether or not you know someone or not with the BFRB, it could be another BFRB person, or it could just be someone else working on something else. And just like having check-ins with each other and offering each other encouragement. It's nice to have someone to help you to be Um, and that said, if you want to connect with other people with BFRBs and you don't already, join a support group. Support groups are a really great way to meet other people, to explore strategies, to talk about what you're doing, what's working, what's not working, and again, that accountability. So definitely recommend that. And I think I'm going to jump to your live questions now. Um, I have some other commonly asked questions, but we can go back to it. I want to see what you guys have because I want to make sure we have time to answer your live questions. So let's see. Yeah, so is it possible to help someone of 56 to get over skin picking? I've done it since young. Yes, absolutely. It's never too late. If it's something that you want to work on, then great. Yeah, work on it. Find a trained therapist, and work on those management skills. Um, yeah, never too late. 56 is great. Hope that answers your question. Oh, wait. Answer live. Okay. Yes, good question. So when we seek support, should we be looking for professionals specializing with OCD? I feel like this is a lesser known diagnosis, and so it's hard to find the right treatment provider. So, so body focused repetitive behaviors, BFRB, which is what skin picking is different from OCD. So an OCD therapist is not, excuse me, is not going to necessarily know how to treat BFRBs or skin picking. So if you find an OCD therapist, you do want to make sure that they are knowledgeable about skin picking in particular. They are different, and so they are treated differently. OCD is primarily treated with exposure and response prevention therapy, and that is not how skin picking is treated. So while it's confusing because they're BFRBs are kind of under OCD and related disorder. It's related, but it is not OCD. So you want specifically a BFRB therapist. And again, it's a little bit confusing because soon there's going to be, again, the provider list for people who can treat skin picking. There is going to be a provider list under the International OCD Foundation, but it is still different from OCD. Um, so you do want to make sure they're knowledgeable about skin picking in particular. Okay. Oh, yeah. So, what if I don't really want to stop while I'm picking, only after? Yeah, that is super common. Don't worry about that because once you start picking, it is so hard to interrupt yourself. So, a part of you, of course, like wants to stop. Oh, I'm going to feel guilty after. But then the other part of you is in the moment, is in a trance, is feeling satisfied, is enjoyed by that sensation, right? Because it does a really great job of regulating your mind and your body. So it's really, really hard to stop once you start. So the best line of defense is to try to work on strategies before you start. Because once you start, yeah, it's really hard to stop. So if you're feeling like afterwards, all of those thoughts and feelings um, come at you, just think about it's okay, be gentle with yourself. What can I do next time? Okay, what can I do next time before this happens? Or even have a plan. What can I do next time? If I'm in the middle of picking, what can I do next time to try to help while I'm picking? But think about it after the fact, because it's unfortunately really hard to interrupt it during. It's not impossible. You can, but it is hard. Okay. So think about it after, reflect, what can you do differently next time? And don't beat yourself up. Okay. It's okay. I'm wondering how exactly the skinpick.com app helps people and if these professionals have therapeutic credentials, etc. Yes. So all of the therapists are mixed. I mean, I think you can look them up. You can look at everyone's profiles. I think everyone's a social worker or a psychologist. They've all been trained. They're all knowledgeable. And how the app works is you can there are different programs. So you can do like you can even do video sessions. Some of the therapists offer video sessions. Um, there's a new feature of voice recording. So it's primarily typing back and forth, or using your voice back and forth. And basically, there are different modules. So it's kind of like the sessions are like lesson plans or like worksheets. So there's information, and then there's a space for you to write your reaction and your practice and how it's going. And then your therapist will respond to whatever you write. And they respond within 24 hours. So that's a little bit about how it works. Um, yeah, definitely, check it out. Check out the website and see if it's something that you think would work for you. It's pretty convenient because you can, type in and work on it whenever you want, and you still have a therapist support. Um, you know, some people really like the typing back and forth, and it's kind of like an email, not like in the moment live texting. And some people prefer like a live one-to-one therapist. So it just kind of depends on your needs. But it's a really great resource. Okay. Oh, yeah. Could you talk about why being told just stop picking is not terribly helpful? I'm hoping my family will watch this later. Yes. Um, telling someone to just stop picking is not helpful at all. In fact, it does the opposite, and tends to make people feel worse. And what happens is if a family member says, just stop picking, you are just going to sneak it later because you are going to feel bad. You're going to feel guilty. You're going to feel embarrassed. And that's going to increase urges. Obviously, if you could stop, you would. You want to stop. right? A big part of you wants to stop, but can't because it is a chronic disorder. So telling you to just stop is very frustrating because, yeah, okay, yeah, I want to, but I can't. So a better way to approach and to be supportive instead of just stop picking um, is something like, what can I get you something right now? Is there anything you want to talk about? Um, or I know it seems like maybe you're starting to have a hard time. Is there something I can get for you? Or to distract you and not even mention that you're picking, right? So if they see that you're picking, they can say, "Oh, hey, can you help put away the dishes? Hey, you mind grabbing me that from the closet, right? So they can interrupt you without directly saying stop, right? So that's a really helpful strategy. Um, they can also help to hand you fidgets, right? So they don't have to tell you to stop, but they can just say, here you go, without saying anything. Okay. Uh, um, And that could help too. You can also have a code word. I find that that's sometimes helpful. Um, so if they see that you're picking, whether or not you are aware or not, having like a code word depending on the situation might help you to kind of be like, all right, fine, fine, okay. And again, to interrupt you. Um, so there are many other ways to address it if they are seeing that you are picking. Um, but telling you to just stop is not one of the helpful methods. Okay. So I hope that information is helpful for your family and other family and everyone. Okay. Ooh, we got lots of questions still coming in. Oh boy. Oh boy. Okay. Ooh, I am an esthetician. I can never pronounce that. Pronounce that. And I specialize in treating acne. Excellent. I have also struggled with skin picking my whole life. I am sometimes the first person someone has a conversation with, great, about skin picking, because we talk about their skin and I can see clearly what they have been doing to their skin. Do you have tips, suggestions, or how I can best be supportive of clients? Um, and when it's time, recommend someone to get mental health help. Like see a therapist. I don't want to go beyond my scope of practice, but it does come up a lot in my line of work, and I appreciate your education and resources. Oh, great. We need more people like you because it's actually hard to find professionals who treat skin and skin conditions who are knowledgeable about skin picking. So actually, I do recommend for you to get on a list. Well, hopefully a new list under the IOCDF Foundation, because the BFRB.org does have a list of professionals. So people who have skin picking, for example, can look through the list and go, oh, this person is in my area. I'm going to go to them because they're knowledgeable. So I'm so happy that you are knowledgeable. And that's great that you want to be so supportive of others. So tips and suggestions, be, being gentle. What are some things that you would want to hear from a professional, right? So again, you are there to help treat the acne, to treat the triggers, and to help with the healing process, not the actual act of picking. So if you're having a conversation with them and you are talking about patterns of picking, you could ask them what are some things that they're trying to do to help. Do they have supports? Do they need supports? Or do they want support? So if they say, they're really struggling and yes, they do want someone to talk to, then you could recommend, there are trained therapists who can help you with this and who can support you through your journey as you're trying to manage it. Because that is helpful to have a therapist at the same time as treating other skin conditions. So both at the same time. And again, you could recommend them to skinpick.com. You can recommend them for now to BFRB.org or the IOCDF Foundation. BFRB Changemakers is an upcoming great resource, and Picking Me dot I always forget if it's com or org, but Picking Me is another really great resource specifically for picking. Okay. What was the name of the Swanson and Now brand? And right now is called NaCN acetylcysteine. Okay. N dash ace with a C. Acet oh, there's a Y in there. Acetylcysteine. Okay. Um, is the amino acid supplement. Oh, examples of strategies. Yeah, so many strategies. So if you want even more specific, if you want specific sensory strategies, check out. I did a webinar on fidgets in particular. So that might be something of interest to you. But in general, sensory strategies are like different fidgets. I'll just There are lots and lots and lots of different fidgets. Um, Cognitive strategies are things like be mindful of what you're telling yourself. So rephrasing your thoughts. So I am feeling this. I am noticing XYZ, right? So you want to kind of gain a little distance from your thoughts. Your thoughts are not facts. So reframing your thoughts is a cognitive example of a strategy. Um, Affective strategy, your feelings. So doing things like breathing, relaxing, art, writing, something where you can be expressive and get out some of those emotions. Even things like exercise, I would probably put in the affective category. Motor are things like barriers. So like gloves, long sleeves, tights, um, pants, things like that. Things where you want band-aids, scotch tape, where you want to block yourself. Okay. So it's motor. Place. So changing your environment. So sitting in a different place on the couch, um, keeping the lights dim or off, covering mirrors. Okay, so you want to make changes to your place, to your location. Okay, just a couple of examples. We can really go on and on, but just to give you a little taste. Okay, so I hope that's helpful. Where to find a support group? Great question. So if you are part of the skinpick.com community, there are support groups through skinpick.com. Other than that, you can, again, for now, you can look on bfrb.org. They do have a list of support groups in different areas. I don't know if bfrb.org, they're the TLC Foundation, they were also doing like monthly support groups. I don't know if that's still happening right now or when that's going to stop. But you can still look on their website, their area. BFRB Changemakers, I believe, is also offering virtual support groups. So you'll have to check some of those resources out. So skinpick.com, bfrb.org, and BFRB Changemakers. You can find support groups. Okay. If you're having trouble, you can also feel free to email us and we could look around for you and see if we can find anything. I can sometimes feel like finding a behavioral strategy that causes me to fidget is overwhelming and it would make me pick more. However, I found using a countdown method, like counting down from 5 to 0 and then move away from the mirror and stop the behavior, was good. What do you think about this? Yeah, do what works for you. So if you're in the moment, I think someone else asked this question right, you're in the moment, it's really hard to stop. So actually, I agree. If you're in the moment, sometimes just counting down or counting up, right, to five, whew, taking a deep breath and kind of shaking it out is a nice way to kind of interrupt it and give yourself a little time to get out of that situation, that trance-like state. Shaking it out, moving around is a really helpful thing to do if you're feeling urges, or if you're in the moment of picking. Yeah, just you just want to move. You move the body, right? Move the fingers, stretch the wrists, stretch your arms, twist, things like that, because it kind of um, sends all sorts of good stuff throughout your body, and distracts you from picking. So do what works for you. I think that that's great. Counting is great. Lying on the floor, stretching is actually really good too. And breathing. Keep it simple. Okay. When you start to make things more complicated, right, you can even, squeeze fists, shake them out. When your strategies are complicated, you're less likely to do them. So keep it as simple as possible. Okay. So if that's what's working for you, great, keep doing it. Are there any specific training centers for providers and therapists you can recommend? Yeah, another really great question. So there are individuals, you just kind of have to keep your eye out for them that offer trainings. Um, but there are no centers that do like regular trainings. Again, the TLC Foundation did. So you can follow up with them and see if they're going to continue that, or if it's going to, again, the training might be start to move and shift underneath the IOCD, International OCD Foundation. So I have a feeling that the IOCDF will be offering provider trainings because TLC does. So my guess is it's just going to move over to the IOCDF. But other than that, they're just individual providers that offer trainings. Marla Deibler is a therapist. I forgot where she works, but she tends to offer pretty regular trainings. Um, and Renee Renardi, they often work together, and so they often do trainings for providers. I think that BFRB Changemakers will be doing trainings as well. They recently did a virtual conference and they offered CE, so that's another organization to kind of keep your eye out for trainings. They do kind of sporadic trainings and workshops as well. So keep an eye out for that. SkinPick.com does not offer specific trainings right now for providers, but we do offer just these like monthly webinars with a lot of different topics. So they're very educational, but they're not specific training. They're not CEs, but they are really helpful. So I do recommend that as well, unofficially. I hope that was helpful. I can't. Uh, Someone posted a link. I'm not sure what this is. Counselor page I came across. I can't look at that right now, but maybe you can email that to us. If you want me to take a look at it or like see what my opinion is about the counselor, um, or have questions about it, just email us at um, oh my gosh, support, it took me a second, support@skinpick.com is the email address. So just email us other questions, or if you want us to follow up on something, support@skinpick.com. So this link that you posted here in the chat, just send us an email and we'll take a look and give you any kind of feedback that you're looking for. Okay. Yeah, not a question, but yes, it's very soothing. I usually pick when I'm stressed. Yeah, it's a way of regaining balance. It's a soothing activity. It's self-regulating, which is why it's so hard to interrupt and to do something else because it works. It feels good. It just has very frustrating consequences. Yeah. Very helpful. I have to leave now. Thank you very well. Thank you for joining us for those that are leaving. But remember, we are recording it, so if you want to watch the rest of it later, feel free. It will be available to you. Okay. Do you have any tips based on skin condition like acne, eczema, etc.? Yeah. So when you have um, skin conditions such as acne and eczema, it makes the urges stronger, right? That sensory urge, that sensory aspect is a little bit harder because you got more things going on, which can be more frustrating. So, the different tips and strategies are the same, whether you have an other skin condition or not. But if you have a skin condition such as acne or eczema, I do recommend seeing like a dermatologist, right? Just so you have someone to help you hopefully manage that condition. So there are other medications, for example, to help with things like acne and eczema. So medication, creams, topical things that help with the acne and eczema will help to decrease that sensory trigger. So that's kind of the main thing that you have to be extra mindful about is you have more of a sensory trigger. So having a doctor, being followed by a doctor to help with that sensory aspect is going to be helpful for you. Okay. Is BFRB genetic? I noticed that my picking was more of a challenge in my 20s, and I am now more aware that this behavior is one that my dad engages in. Yep. I wonder if either of my children may develop this. I would like to be better equipped to support myself and possibly them in the future. Yeah. So, as I mentioned before, right now research is showing that there's a large genetic component. So yes, there's a large genetic predisposition. If someone in your family has um, picking or pulling or biting or twirling or scratching, right, there's something there. There's some kind of gene for a BFRB, and so that means that you are more likely to develop it in combination with other factors. So just because your dad has it, just because you have it, does not mean that your kids are also going to get it. But it does put them at a little bit of a higher risk chance for getting it. So it's that in combination with other factors. So there's not much you can do to like prevent it from happening, from popping up other than keeping a warm and comfortable, relaxing, supportive, loving environment, right? Encourage expression, teaching your children how to verbally express themselves or creatively express themselves, right, when they're feeling overstimulated or understimulated, and kind of help them address that, especially when they're younger, just to kind of develop those kinds of skills, right, those coping skills. Um, and that's really all you can do. And even if you do that, it still might unfortunately pop up, or it might not. But at least they're going to be, like you say, better equipped for managing it if it does pop up. Okay. Again, the most important thing is just to keep a loving and supportive household. And the more you know about it, the easier it will be to help if your children wind up getting it. Okay. What's the best way to get in touch, reach out to your group? I think you mean, by your group, you mean skinpick.com. And if you have questions about the program, yeah, that you just email support. You can see directions on the website, or you can just email support@skinpick.com. Okay. Oh, follow up on the skincare professional's question. To be helpful for someone struggling with picking, like a skin picking certified type thing, so people know you are a safe place and can help. Do you mean, I'm not sure what you mean, or if this is a question for the esthetician that was here. Follow up on the skincare professional's question. Is there a training or course you know of for non-medical professionals to take to be helpful for someone struggling with picking, like a skin picking? I don't know of any skin picking certification type program that um so people can know you are a safe place and can help. Yeah. However, you can, as a professional, for now, again, reach out um, to bfrb.org because they do have a list of professionals. Um, and I'm wondering if maybe as that information gets transferred over, maybe skinpick.com can save that information so we can kind of start developing our own list as well. It's not a bad idea. Um, so people kind of have a list of of recommended people or trained people, knowledgeable people, so people feel more comfortable going to them. Yeah, are there are lots of now there's lots of resources, so I do recommend checking out that website and checking out skinpick.com also has a lot of resources. There's a regular blog in addition to our monthly free webinars. So if you can attend the free webinars, as many as possible, or check them out later because they're all recorded, or sign up to make sure you get the newsletters and the blogs because there's a lot of good information. It's a really great way to educate yourself. So I would recommend, those are some things that I would recommend. Uh, you know, someone's asking, are those on this call able to somehow connect with each other? I thought that would be helpful. Unfortunately, not, because everything is anonymous. There's no way of connecting anyone to anyone on this call. Um, that's a good question, and I don't know if there's any way we can remedy that in the future. I'll have to think about it. um, if you were to join a support group, whether it's through SkinPick or through another resource, you can certainly connect to people that way. So I think that that's probably the best way to connect with people. There are lots of like Facebook groups as well and communities. So, if you're clicking with someone, you're seeing some posts or you're responding back and forth with someone, that's another way to connect with someone. But through these free webinars, there's no way of connecting to people, two or more people. So I'm sorry about that. But yes, that would be helpful, but we can't do that. Thoughts on long versus short fingernails? Yeah, is one type typically better for BFRBs? Sometimes I feel like having long fake nails help me not pick as much, but I also feel that they can be more damaging if I do pick. I mean, yes and yes. I imagine fingernails are a trigger in a way for some people thoughts. Yeah, so you are right. Um, for some, um, short nails are better, and for some, long or having fake nails are better. It just depends on the person. Um, you know, Short nails is easier to grab, right? Probably easier to grab. You can feel more. Um, Long nails or fake nails, however, you can kind of get more details with. So they both have like pros and cons. I would say, I don't know. I don't even know. I want to say that having that people tend to um, find that longer nails are more helpful, but I don't know. It may actually be like 50-50. I think it just kind of depends because I think there are pros and there are cons with both. So it just kind of depends on you. It's definitely a strategy to get fake nails. Um, but again, it's not going to work for everyone. So you'll just have to experiment and see if that's something that works for you. I also find whether or not you keep nails short or long, painting your nails and actually painting them different colors or having one nail a different color, um, for some reason makes it more interesting and is distracting. So if you go to pick and you see that your one nail is a different color than the rest, it kind of like stops you for a second. Because it's more interesting to look at. And all you need is that little pause. So if a nail is a different color and it helps you to take that pause, great. So you can do that whether your nails are long or short, just kind of painting. And the act of painting your nails is also pretty satisfying. And then you have to wait for them to dry, which helps again to decrease the chances that you're going to be picking in the moment. Yep. So someone posted, I mentioned BFRB change makers. Someone posted, I can't share the post, but yes, so they do have some support groups. Yeah, and they're still building their website. And so definitely one to kind of keep an eye out for, BFRB change makers. So they are offering, right, support groups and they have some workshops and some trainings. So that's a good one, to keep an eye out on. And glad that this webinar is helpful. Very good. Thank you. My dermatologist blames picking for acne like a site. Oh, it's a very dismissive conversation and not just a comment. Oh, that's frustrating. Oh, it's hard to find a supportive dermatologist. So, I mean, yes, it can be a cycle, right? If, acne comes up and you're picking the acne and then you're getting more oils into it, and then it's going to potentially cause more acne. So it is a really frustrating cycle. But that is not a very nice response from your dermatologist. I mean, I would almost recommend seeing if you could switch to a different dermatologist because that's not going to feel good every time you go. You want a dermatologist that's going to be supportive and that is going to be understanding and try to help you with just the acne, not the picking. So things like different kinds of creams. And by the way, pimple patches are really helpful. Some people have a reaction depending on where on the body. So just something to be mindful of. But pimple patch cover up the acne or the spot. So it acts as a barrier, so you can't pick at it or it stops you for a moment. You can always take it off, but it allows for that pause. So you can put the pimple patch on, it blocks you, and it's helping the acne heal underneath. So that can be a really helpful tool to use, pimple patches. Okay. You can get them clear. They can be um, very non-obvious so you can wear them out in public, or you can have like fun shapes and have fun with it, and have like stars and hearts and stuff. So definitely recommend that. All right, I see some questions wrapping up. We are at one. I'm gonna keep going. We just have a couple more questions, so I'm gonna answer as we're starting to wrap up. Yeah, so can you talk about the connection with ADHD and autism? So BFRBs are different. We'll start with that. They're different from ADHD. They're different from autism. Um, ADHD and autism can be potential co-occurring disorders. ADHD is a really common co-occurring disorder, as you can imagine, because someone with ADHD often feels overstimulated or understimulated. Right. So it's a wonderful combination, right, of ADHD and BFRBs. Very common. different, but uh, um, very common. It makes it a little bit more sense. But other, if you have, you're still treating your BFRB. It's just you have some other things that you have to take under consideration. Okay, hope that was helpful. Um, oh, good. Yes, thank you. I answered someone's question. Good. Glad, glad that I did that. Thank you so much. Skin picking doesn't seem to be as believed as hair pulling. Language to help explain. Well, it's different. So there is a skin picking disorder and there is a hair pulling disorder. Um, so they are different. And they're both BFRBs. They're both body focused repetitive behaviors. But skin picking, hair pulling, nail biting, right? Those are three different BFRBs. Um, One can have just one of them. You can have just skin picking. You can have skin picking and hair pulling disorder, right? And nail biting. So you can have one or you can have all of them. It is very common for someone to have more than one BFRB, um, especially if you're trying to manage one. Like, let's say you're trying to manage skin picking, you might go up to hair pulling, right? So they kind of can swap a little bit. Um, yeah, so they are, I think what can be a little bit confusing, sometimes skin picking can look like hair pulling, or vice versa um, if you have ingrown hairs. So if you're like picking at the ingrown hairs and digging for the ingrown hairs, that's where it's a little bit confusing, I would say. Is this skin picking? Is this hair pulling? So in order to distinguish, think about what are some of the other patterns. So if you're digging ingrown hairs, are you also like picking at acne, picking at scabs? Or are you also pulling other hair besides the ingrown hair, right? Eyebrows, eyelashes, scalp, armpits, pubic hair, arm, leg. So that's where you want to like think about, is this skin picking or is this hair pulling, or do I have both? Okay, so I hope that that clarifies a little bit. Um, are there any other questions? We are at the end of the live questions. I'm not seeing anything else unless something else is gonna pop in. I'm just seeing some thank yous. You're welcome. Glad this was helpful. If other questions come up later again, or you want clarification on something, please feel free to email us at support@skinpick.com. We do have these regularly, so if you enjoyed this or other questions again pop up later on, feel free to join another session. Okay, so I hope everyone enjoyed this. I hope this was really helpful, and I'm glad that we are able to offer this opportunity. Um, Great, and I hope everyone has a great start to their new year, and maybe we will be in touch. Okay, thank you so much, everyone. Oh, thank you. Take care.